You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show. So again, we are in the period of COVID. We just have a new variant and things like this are coming around. I have absolutely zero doubt that if you breathe the way you should, or your breathing, IQ is higher, and you say, it will be helpful and productive, A, maybe not to be infected at all, or B, if you are infected, to be able to deal with it more effectively. So let's take it to the opposite end of the spectrum. Suppose we have a person right now who just says, can you give me one thing to do right now while I'm even viewing you? One little thing. Where would you start? What should I do right now?
Well, I would tell them to go to thebreathingiq.com and definitely get their breathing IQ. You just fill it out, you get a grade, because then at least you know where you are. Mechanically speaking, how am I doing as far as breathing, as far as the mechanical component? But what I want you to think about, and you've mentioned this, is that how animals breathe, and you don't see shoulders moving. So I actually want you to take your shoulders and roll them out and really think about, you know what, my shoulders are not supposed to be moving. My neck is not supposed to be engaging. This part of my body is supposed to stay soft when I breathe. And then what I'd like you to do is I'd like you to tip your hips. So you're probably seated because we sit a lot, and that's usually the posture that we're in, is that I want you to inhale, but when you inhale, I want you to tip your hips. And the best way to explain this is if you do yoga, cat-cow. So Adiel, do you know what cat-cow is?
I do.
You do, okay. So there's the movement where your belly comes down, you're on all fours, your belly comes closer to the floor. And then on the exhale, you round your back and supposedly you look like a cat, scary Halloween cat. So when you think about doing that movement, your hips are moving. So on the inhale, it's called an anterior pelvic tilt. And anterior is interesting because people get it mixed up with posterior, but anterior would mean that I always think of the word in Spanish, antes, which means before. So your hips come forwards, the front of your hips come forwards. And if you look back, you have your butt is back there. You have what's called selfie butt. That's not a medical term. Your hips go underneath you. And when I say underneath you, I want you to think about if you have a dog and they're scared and their tail goes underneath them when they're scared. That's the underneath that I want. That's your posterior pelvic tilt. That's the exhale. So on the inhale, belly comes forwards, shoulders are soft. And behind you, you can see your butt. You have a rounded, popping your butt back in back of you. And exhale, you round your hips underneath you and you squeeze your belly and you try to get what's called scooped out, not just braced, but belly button towards your spine.
So you exhale as a cat and you inhale as a cow.
Exactly. Exactly. And sometimes I'll take people is that we'll do cat-cow on all fours. And then I'll say, okay, let's take that cat-cow and sit them up on a chair. And now we're going to do inhale, exhale, cat-cow, just like that. Shoulders don't move. It's really the hips. And that's where you start understanding, oh, the pelvic floor and the breath go together. So you should be feeling an inhale and an exhale, and your breath really should be from your armpits all the way down to your pelvis. Neck and shoulders really shouldn't be working all the time with every breath at all.
To me, that was a fantastic tip, because here I am sitting in a chair and interviewing you. I wasn't going to go on the floor and do a cat-cow, but the minute you said it, I did it in my chair. And when I did it in my chair, it was obvious beyond doubt what happens where you inhale and when you exhale. It's completely evident just by doing a little cat-cow on your chair.
Yeah. And as you can see, the exhale is enthusiastic. And there are those that say that the exhale should be passive. But our exhale in the last few decades has gotten so poor that I actually encourage people to exhale a little bit more enthusiastically, just because it's gotten so bad. Letting go on the exhale is not really helping us at all.
You know, that kind of brings a lot of things into focus. We did an interview about humming generating more nitric oxide. And I'm thinking about singers, or when we hum. Well, you know, if you want to strip it down to what we're talking about now, humming or singing is an enthusiastic exhale.
Mm-hmm. It should be. Yeah. And if it's not, you have a very large, powerful microphone in front of you.
Exactly. Yeah. But I mean, that's why, somebody once told me, a voice coach, that singers, if all things are the same, live 8 years longer. I think that has to do a lot with that.
Yeah. I'm going to go back and find this, but I heard that conductors also live longer, not because they're singing, but I think because of the flexibility of the movement of the thoracic cavity. So singers, what happens is that they extend their exhale, because think about it. Voice is an exhale. It's an audible exhale. And if you're singing, you're trying to extend that. So you have a better exhale. You certainly have better exhale muscles. So it would make sense that someone who really sings, is going to have better lung functions. And as we know, lung capacity, but even more so lung velocity, is something that corresponds with longevity. So that makes perfect sense to me.
Yes, absolutely. It makes a lot of sense. And I think that exhaling with enthusiasm really just means going back to exhaling as we should. I bet you, or you can tell me, if a 3-year-old kid doesn't exhale with enthusiasm without meaning to.
Mm-hmm. Well, I usually look at kids that are a little bit older, because your 3-year-old, and this is where people talk about the belly breath in infants. I never talk about infants, because infants, can't breathe, take instruction in that way, but they also don't have the maturity in their muscles to breathe any other way. So when you think about someone who's breathing horizontally, the inhale is expanding, the exhale is narrowing. But if you are a vertical breather, which is what most people are without being trained, or rather, having picked up the bad habit, your exhale is down. And if your exhale is down, that's a very inefficient exhale, because it should be exhale. So just changing to that horizontal breath is going to mean that your exhale is way better than it would have been before, when you were inhaling up and exhaling down. I know that's pretty complicated, but in just changing the mechanics of your breath, your exhale can get better. And one of the reasons that this is terrifically important nowadays is because when you get bronchitis, pneumonia, COVID, whatever variant is coming out, that your exhale and your cough, which is an exhale, is efficient and productive, is tremendously important as far as your healing.
So again, we are in the period of COVID. We just have a new variant and things like this are coming around. I have absolutely zero doubt that if you breathe the way you should, or your breathing, IQ is higher, and you say, it will be helpful and productive, A, maybe not to be infected at all, or B, if you are infected, to be able to deal with it more effectively. What do you think about that?
Absolutely. Well, someone who breathes well and has strong breathing, meaning strong breathing muscles, is going to have less risk factors. So for instance, if you already have some sort of COPD or asthma, or you have high blood pressure, or you have a lot of stress and therefore, have inflammatory response in your body, all those things put you at risk for COVID, are risk factors. And all those things can be minimized by better breathing. So obviously, if you have COPD, it does have to do with lung tissue, but better mechanics can help tremendously sometimes, at least help you have a stronger breath, regardless of what's going on with your lungs, because what we're talking about is the mechanics and the muscles on the outside, but also blood pressure. To me, that most doctors, not all, but most doctors do not recommend breathing exercises to their high blood pressure patients is devastating, is really devastating, because blood pressure can be controlled, not completely in some cases, obviously, but it can really positively affect blood pressure in such a healthy, empowering way that they should be recommended immediately when someone comes in with high blood pressure. And then again, to stay on the line of COVID, is that if you breathe well and you get COVID, your lungs are going to be better ventilated because you are a better breather. You are going to be able to cough more efficiently because you have a better exhale and stronger breathing muscles. Again, it's going to be interesting what research comes out with. Right now, I see quite a few COVID patients and consult on COVID, because we're seeing pulmonary functions go down so much after COVID. So someone who's had COVID has worse lung functions, which then again puts them more at risk for the subsequent bronchitis, pneumonia variant that's out there. So things are pretty complicated and pretty serious right now. The good news is that there's things you can do that's just about you owning this powerful body, this efficient, powerful body, and just working it and using it the way it was designed.
You know, as a non-expert, even as you were talking here, my three takeaways so far, and there are many more, you said about being a horizontal breather rather than a vertical breather. Just this idea is already very, very powerful for me, at least. Then the thing you said about the cat-cow and being able to do it even in the chair as I sit, I've been doing it now for 5 minutes. It is a revelation, just this little thing. And then, of course, the idea of expanding in the middle at 360 degrees, those, at least for me, I find are very useful and tangible. And I hope they are for our viewers, as well. But I think really, to me, I think I would like to go for a one-on-one with one of your instructors, and I'm going to go that route because, again, it's the same as having a personal trainer in a gym. Why not do it exactly right?
Yeah, and they push you as well. I mean, people laugh when they say, when I do group classes, you sweat. You do sweat. It's not there's parts of the class that are calming, but it is a workout for your breathing muscles. Just like when you go and you work out with a trainer. I don't know about you, but I work out harder. I'd like to think I can work out on my own, and some days I have are good, but there's other days that working out with a trainer really pushes you and really corrects things that you're doing wrong. And it can be really useful. I think
you're talking to a person who wrote and performed a song called Lazy Bones. So I know all about it. Yeah. Listen, I hope you don't mind. And if you don't want to talk about it, but I'm super curious. Obviously, you're a woman of many talents and interests and many things that it's really fascinating. And I'd like to think our show is also about many, many subjects and interests. I could not help but notice that you wrote a book about a subject that I find very fascinating. It doesn't have to do with what we're talking about here, but it was for younger women who are dating men who are older. How did that come about?
It was commissioned. Unfortunately, that's the straightforward answer. I was working in publishing at that time, and this is such a boring answer. I'm so sorry, but
no, please say some more.
A publisher that wanted someone to write on this topic. I didn't know a lot about it, so I actually called a friend of mine who's a psychologist who actually did date a lot of older men, and I wrote the book with her and got paid for it. And it was a fun book to write, for sure. Not I have several books that I've written that are not my favorites that I never talk about and that I wish weren't out there. I think that happens to everyone as they're writing, that just didn't come out the way I wanted to, or didn't have the right cover. One of them, for instance, that I loved, but the publisher gave a god awful, embarrassing cover to, was Get a Grip, Your 2-Week Mental Makeover. And I hated the title and I hated the cover, but I loved the book. And it made me so upset because I had read a book, I'm not sure if you've heard of it, called The Artist's Way. And The Artist's Way is a fantastic book that helps you journal, sort of look into yourself and do a lot of work. And it's a very famous book. It's a difficult book, but it's a famous book. And a lot of it is for people who are either in recovery or who are artists. And I love the book. And I thought, I wish there were a book that were maybe a little bit more simple for kind of us folks, maybe who are not artists or don't have a recovery background. So I wrote this book that was about journaling while you were in therapy or instead of therapy, because I wrote it at a time when there was a big change in insurance and managed care. And I was seeing that a lot of people couldn't come to therapy anymore. So I wrote the book as someone who would ask their patient every week a question and have them talk about it, because I wanted people to have that. And the publishers put this terrible cover on it, which was a cartoonish picture of the side of a woman in one breast and a bra strap, and she's crying. It was terrible. It was nothing to do with the book because they wanted chiclet. And then they gave it this Get a Grip, which I would never say to the patients, get a grip. Dr. Phil might, but not me. Anyway.
Okay, let's make two things happen. Number one, let's do and undo. So if you had to call that book by a name that you chose, what name would you give it?
It probably would be something like, Page by Page, or In My Own Words, or Free Associate. It might be Free Associate's kind of got an interesting twang to it, especially if it was Free Associate, 2 weeks of self-therapy.
I actually liked Page by Page, but of course, it needs to be a group effort, and of course you wouldn't have a picture, you wouldn't have a cover, depicting what you described. That just seems very silly, really.
No, and that book was written to be for men and for women. There was no specific gender in it.
Frankly, for me, if I picked up a book and I see that picture, I'm saying this is not a book for me.
Yeah, it was really too bad. It was really too bad. Anyway, so yeah.
Because I burned my bra, so I can't. But to make the what you said, no, this is a boring answer. It was a commission about the older men and younger women. Nevertheless, let me make it unboring. You worked with a psychologist friend to write a book. I already got that if you do something, you do it well. You're going to write a good book. I'm sure that it's a great book. So you studied, you learned a lot from your friend's work with other people and her experiences. For you, it must have been a learning experience.
Oh, yeah. Writing that sort of book that was a relationship dating book, I love doing things I've never done before. So, if you said to me, I want you to write a cookbook, I would love to write a cookbook. I would have to do so much research. It would take me a very long time because I'm a little bit of a type A. So I'd have to research everything. But to do something I've never done before and I can learn in the process, how fantastic is that?
Yeah. So that's really is very, very great. But I think the breathing, again, I was going to ask, how can somebody make it into a habit? Because we breathe like 20,000 times a day or something like this. Now it's become very clear to me. I want to see what you think about it. As I sit here and I breathe this way, it's very clearly great. I can't quantify it exactly. It just feels great. That's just so now I think that's a partial response to how do you make it a habit. Let's say I sit here, I breathe like this, I breathe well, I take your course, I breathe well. I get upset, I argue with somebody, I brace, I breathe, and I breathe badly. But then I return to it, and the more it feels fun, the more it wants to make you do it, right?
Yes. I mean, you just answered your own question even better than I would have answered it.
Not better, but.
So, the two things I say to people when they say, how long is this going to take? Is I say, well, you used to breathe this way. And not to get corny, but I really believe that especially with the diaphragm and its attachment to, or its relationship with the psoas muscle, which is a very emotional muscle, and the fact that it has to do with your gut, your second brain, is that there is a recollection somewhere deep inside of you of having breathed this way. And often when I ask people, because remembering or trying to guess when your breathing changed is really important. So when do you think it changed? You might say, you may not be right, but just to get you thinking, I think it changed when I was 8, because that year I gained a lot of weight and kids started making fun of me and I started bracing. And even as an adolescent, once I leaned out and grew, I still had this concept of being heavy. And you may have a story that goes along with it. So for you, you remember your body and your posture changing when you were 8. With some people, they can say, I think it was when I was 5 and my sibling died. Or they may say, I think it was when I was 20 and I had a C-section and it was very painful after my C-section. I didn't want to expand and inhale. So everyone has their story, and remembering your story, or at least starting to guess at it, is tremendously helpful, because you used to breathe perfectly. You used to breathe perfectly. And again, the second part of that answer is that, if I may, your diaphragm wants to breathe that way. And I know, again, that's making the diaphragm have a goal and a mission, but I think it does, is that it wants to flatten. It wants to push the ribs open. It wants to descend and massage your digestive organs. That's how it was designed. So you may have 10 or 20, maybe 30 years of keeping your diaphragm constricted and locked up. It wants to expand your body. So those two ideas make it not be something that you need to practice, like taking vitamins, but it's just actually a big change in the way you breathe every day, all day long.
Well, when you said you hesitated to say that the diaphragm wants something, but I think it really does. And in the book about the warrior breathing, which I have right here, there's a picture which I love. You're showing a steamer, the standard steamer that has those little wings that come up and down. And you open it, and that's an analogy to what happens when the diaphragm expands when you inhale, and then it closes so you can steam. And the steamer doesn't have a mind, but you can still say that little steamer wants to open and then it wants to close. That's what it was made for.
Yeah, you're a poet. That's exactly it, is that it does have intent in the way it was designed. And that's right on it, is that's what the diaphragm wants. And sometimes I really believe that sense of relief that people get once they start breathing that way, and sometimes they even get teary and they're shocked of, like, why do I want to cry? I'm not sad, but my eyes are filling up, is really the having been braced all this time, and now actually the body being able to do what it's supposed to, is just an incredible relief for someone who has been completely braced, possibly for decades.
You also said something just now that you said in passing, but I think it really it was interesting. Now everybody likes to talk about the microbiome, the gut, our second brain right here in the gut. Well, if we breathe fully, if we really move the whole, there is no way that it can't have an effect on all the universe that lives inside of us, the gut and everything. When it moves properly, when it moves more, must have a beneficial effect.
It's supposed to. I mean, the diaphragm is in the body so that it can massage the organs underneath it. So think about it. You have not only your second brain, which is your gut, but you have your pancreas, your liver, everything there needs to be stimulated, and lymph needs to be flushed out as well. And that doesn't happen as well, and sometimes not at all, if the diaphragm's not moving. So the implications, once you start understanding and thinking about this, it really is, like I said when we started, that the diaphragm affects everything above it and everything below it. And often we don't realize that a problem we have may be related to a diaphragm that's amnestic, that's not moving, because it's so far away from the source. So for instance, I have pelvic floor pain. Well, it may be that you're not breathing diaphragmatically, and your diaphragm and your pelvic floor have a connection. They're supposed to be moving together. It could be that. Or the whole concept of acid reflux. If you look at a picture of the esophagus, it goes through the diaphragm, and there's a sphincter there, which is actually connected to the diaphragm. And if the diaphragm isn't moving, that sphincter isn't closing the way it should. And these examples go on and on. Yeah.
Fascinating, because, when you say all of those things, I'm thinking about all the many experts that I've talked to, and some of them specialize in one subject, like sexuality, or it seems like that would affect everything. It would affect sexuality. Obviously, the pelvic floor, come on. And quite interesting. But when you were talking about the diaphragm not moving, I was listening to what my response was. What association did I have when you said, if it's not moving, it doesn't give those massages to the internal organs? The word that came up for me was the word stagnant. Mm. So if we don't move it, it's all stagnant in there, and it doesn't sound very beneficial.
And I'm assuming that the word stagnant comes from possibly your interest in Chinese medicine that talks about stagnant blood or stagnant organs. And a lot of the disease we have comes from stagnation, lack of mobility, which now is not only internal, but external as well. It's interesting. I remember I had somebody, it might've been on social media, respond to me and say, you can't not breathe without the diaphragm. Like, you're always using the diaphragm when you breathe. And I disagree, is that you can be breathing with your neck and your shoulder muscles exclusively. And I've seen this because I've done diaphragm ultrasounds, and I have watched someone breathe and seen the diaphragm not move at all. Now, this is actually a good thing. If you have phrenic nerve damage and all of a sudden you can't breathe with your diaphragm, it means that, luckily you have your neck and your shoulder muscles, auxiliary muscles to breathe from. You won't die. But can we breathe without the diaphragm moving very much at all or not at all? Absolutely.
Right. Just like a little bit here, just from here, a little bit. Yeah. Dr. Vranich, this is absolutely fascinating. As we are getting going, I know we can speak for 5 hours, but we have our 1 hour here. Thank you so much for such a vital, fundamental, and important knowledge piece that we all need. Thank you so much for being here today.
Absolutely, my pleasure. I love, it's few and far between when I actually get to speak to someone who obviously is passionate about this sort of, interested, we've got interest, but passionate and that really understands the implications really makes my job wonderful and much more fun. So thank you for having me on. It's been my pleasure.
Thank you so much. Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.